Hello, everybody. So to close out this section on cannabis and the body, we're going to talk about how cannabis may revolutionize the practice of Western medicine. I do believe we've learned so much from cannabis. I think it's going to really change how we approach medicine in general. So here's how it started. I was just hanging around and thinking about cannabis and shaking my fist to the science gods, thinking, why, oh, why is cannabis and the endocannabinoid system, why is it so complex? No other system is so complex and so individualized. Why can't cannabis be more like alcohol? And then I thought, wait a minute, no. Alcohol is incredibly complex and we still don't fully understand it. It works on plasma membranes and GABA and glutamate and dopamine and opioids and others. And not only that, alcohol's effects depends on race, on sex, on time of day, on what you've eaten, on your liver function, your tolerance, your genetics. So this very simple molecule, alcohol, even that is not complex and has very different effects. And then I started thinking about some other drugs as well. So cocaine, there's genetic differences. Some people are cardiosensitive. Um, some of you of my age remember Len Bias, who's a very promising basketball player, and the very first time he used cocaine, he died. So some people are just cardiosensitive to it. Going back to alcohol, women in general have less of the enzyme that breaks down alcohol, so they get more drunk with the same dose. Some people of Asian descent have what's called flushing syndrome. So they have less of an enzyme that breaks down one component of alcohol. It's called acetaldehyde dehydrogenase. And they get kind of nauseated and have flushing feeling. It's Valium. Valium in the elderly is metabolized very differently. The half-life in the elderly is about 10 days. So it can take a long time to clear that. So drugs have very different effects in every body. So cannabis, as we're thinking about how complex it is, cannabis can help us to remember that medicine is not one size fits all. So yeah, cannabis is complex, has a different effect in every body, but this can help us to remember that every body is different for all of medicine. We like simple answers, but we have to remember that the body is complex and there really are no simple answers. There's a few things that we think are quite simple. We believe that depression is due to low serotonin, and SSRIs are a magic fix to raise your low serotonin levels and fix your depression. And there's no evidence really that supports that at all. Depression is influenced by genetics, your response to stress, neurogenesis, how the creation of neurons in the hippocampus is. It depends on your personality, the environment. It's a multifactorial condition. And while we're talking about serotonin, there's at least 14 different serotonin receptor subtypes so far. So it's not simple. We pretend it is. Weight loss. We pretend weight loss equals calories in, calories out. Calories in equals calories out. And no, we've known that for decades. That's just not true. There are no calorie receptors in the body. The body doesn't speak calorie, it speaks hormone. And weight is dependent on hormones and your age, your sex, when you eat, how often you eat, what you eat, all those things matter. So yes, cannabis is complex, but so is the body. So here's cannabis metabolite illustration. So the cannabis is complex, but this complexity is beautiful. And we need to embrace it and recognize that there really are no simple answers. Another way that cannabis, I think, can help us and change Western medicine, we need to honor the patient, not the pill. Americans love and trust pills. Most Americans are on at least one prescription pill. And I do have to say, whatever this pill is, I think I want it. She's having entirely too much fun taking this one. But we love our pills in America. And it's basically like, here, take your 325 milligram pill. And oh dear, doctor, I just grew a hand from my forehead. Well, here's another pill to deal with that. Doctor, my feet just turned blue. Well, what's wrong with you? Here's another pill to deal with that side effect. We trust the pill and what it's supposed to do more than we trust ourselves and our patients. The message has sort of been, what's wrong with you? The pills should work. Now, we love our pills, but you have to remember, a headache is not a sign that your body is low on aspirin. It may be dealing with symptoms. It may be covering up symptoms. And cannabis approach is different. And cannabis may already be decreasing our use of pills. Prescription pill use is down in the United States in the last few years. The average number of prescription pills taken by a person has gone down. And we see some anecdotal evidence and some clinical evidence is starting to come out that when people go on medical cannabis, they stop using prescription opioids and benzos and antidepressants. Now, we can't definitively say that it's causation, not correlation, but it's probably played a role. And as we gather data, we'll get a better picture of all this. So we love our pills, but we have to honor the patient, not the pill. And when I first heard in dosing, in cannabis, we say start low, go slow. And when I first heard that, I again shook my fist into the sky, saying, that's not science. Science is take your 325 milligrams. It's not try a little and see how it works. And truly, that is how the FDA is able to approve a drug. The drug has to be consistent and precise. But we do say, start low and go slow. But there is a value in this. This type of dosing can really change our relationship with the drugs and with our own bodies. Because it's about take some, and how do you feel? Not the pill is right and the pill should do something, but how do you feel? And that is really important. That may help us to focus inward rather than outward. We are very externally oriented in our attention. It's 12 o'clock, so it's time to eat. Don't pay attention if you're hungry. Just say, oh, the external cues tell me it's time to eat. And we're inundated with messages that compare us to others and usually tell us that we're lacking in some way. And this is much worse with social media. We see these images that are photoshopped, that are fake, but we compare ourselves to these. We have this external focus of attention. And most of us prioritize this external oriented attention. It's largely controlled by the prefrontal cortex. So you sit in front of the TV and you eat and you don't even notice what you're eating, but your bowl is empty and that tells you, oh, I must be full. But internally oriented attention, that's controlled by a part of your brain called the insula and the posterior cingulate gyrus. That's more important in mood. And focusing inward, even for a few moments, can bring us back to ourselves. That's what meditation is. Meditation boosts activity in the posterior cingulate gyrus. And meditation, I'll say, is at least as effective in treating depression as SSRIs are. So just by telling our cannabis patients, start low, go slow, keep a journal, pay attention to how you feel. They may be taking some little bit of time and focusing inward. How do I feel? So encouraging patients to focus inward, pay attention to what their own bodies are telling them, that can be part of the cure for depression. And one more thing. Hopefully cannabis and what we're learning about it can encourage us to critically evaluate the information, which we're not particularly good at. This is not a science-friendly time we're living in right now. But when you're considering cannabis, it's so complex. You have to look at the studies that are done and really read the methods section and say, oh, well, was that an isolate they used or full spectrum? It matters. You're going to have a different effect if it's pure THC than if it's a full spectrum. The dose matters. Remember the biphasic dose response curve. A low dose can have the opposite effect of when you have a high dose. You have to consider the route of administration. And if it's gone through the first pass effect, you have to consider duration of use and the condition. There are so many details we have to consider. And we do for all science. But since we acknowledge that cannabis is so complex, maybe this will make us step back and remember to critically evaluate the information. And we, the advocates, the educators, we have to be vocal. We have to be proactive. And we can help people learn how to evaluate the information that's out there. We need to show people what a good source of information is and how to critically evaluate it. And if we could do this, that would change everything. We could really encourage people to think and evaluate all the information we get. So, to summarize, cannabis may help us change the nature of Western medicine and may help us to critically evaluate the data. It may help physicians to remember that every patient is unique, every body is different, and we should honor their experience. And cannabis may help us inject a note of awe and wonder at the complexity and beauty of the body and encourage us all to relax, eat, sleep, forget, and protect.